Hello viewers, good day to all of you. This is Dr. BK for you, and today I am here with one of the most interesting topics of the lower limb and also a very important topic on the examination point of view, and that is the arches of the foot. So today we are going to discuss about the arches of foot. Now, first coming to the arches of foot, so here you are able to see the various foot of the humans as well as the lot of primates from which we have evolved. Now, our foot, to put it simply, we can tell it is an engineering marvel. So, one more thing, my humble opinion is that of all the things which is created in this world, it is the design of the human being which is of utmost superiority. It has evolved to such a great extent only if we understand this, and mainly through the anatomy we can appreciate its greatness. Now, when you just look at the foot of the primates and compare it with the humans, the first thing you can see, certain foot is actually larger in size, and main thing you are able to see here, so the hallux is somewhat away, and then next thing, if you look at it, the human foot has got an arched pattern. You are able to see medial side and lateral side, which is not seen in the other primate foot. Okay. Now, mainly what happens in the lower forms, the foot is mainly for prehensile function and grasping. Okay. So, because they will be climbing on the trees and various surfaces, so they have to grasp with this foot, and then they can use their forelimbs to actually pick anything for eating or for other activities. Okay. So that is why you can see the evolutionary change in the foot is so evident when we closely observe or compare the human foot with the other forms of mainly the primate foot, which is our closest ancestors. So as I told you, it is mainly for grasping and a tactile organ. From there it has evolved to an organ of locomotion. So we propel or walk forward with the help of the foot. Okay. Now, does the foot only support locomotion or propelling forward? No, it has also got other functions like weight bearing. For us, the two lower limbs are the weight bearing limbs. So the weight is transmitted to the each foot. Then what happens is propulsion and weight bearing. And apart from that, during walking, our foot has to adapt to the uneven surfaces. Okay. For this, only the foot is actually designed or constructed in such a manner. Now, if you compare our foot with the palm or our upper limb, it is less mobile. Then the bones of the foot are not that much freely movable. Okay. This is mainly for an adaptation to the walking on the ground, and not only that, as I told you, for walking on the uneven surface. So this type of foot, the arched pattern of the foot, and the shape of the foot, what you see here, posteriorly it is somewhat narrow and anteriorly it expands, is unique to the man. Okay, so on a lighter or a funny note, so that is why we actually spend so much of money on actually procuring a footwear. So from thousands to lakhs, we usually use different types of footwear, ranging from your shoes to slippers, heels, sneakers, sandals, all those things. So foot actually has a special part or distinct part of our body, and right starting from the earlier periods to now, man has always paid attention to this part, that is the foot. So this is one of the main thing which actually separates or differentiates ourselves from the primates. So mainly, as I told you, supports the body weight and acts as a lever to propel the body forward in walking. So it has to overcome the inertia and propel forward. So not only in walking, this arched pattern of the foot is mainly helpful when you jump or when you run. The foot should not get collapsed when you jump from one surface, from a higher surface to a lower surface, or from a lower surface to a higher surface. Now, if you look at, mainly the foot is responsible for the walking. So our walking mechanism is actually called as the gait mechanism. So gait mechanism mainly starts from the stance and then it goes to the swing phase. During the stance phase, the foot is on the ground, and during the swing phase, the foot is off the ground. Okay, so mainly when you walk, and one walking or cycle starts with the heel strike, and then what happens is, with the heel strike of the same foot, one cycle ends. So the stages will be from the heel strike to the another heel strike. You have mainly mid stance phase, then acceleration, mid swing, and finally you slow down or deceleration phase. So what happens is, mainly during walking, the weight has to be evenly spread. The weight actually has to be evenly distributed. So if you look at, for example, the weight of the body is evenly distributed equally to both the lower limbs. If you are actually 60 kgs, 30 kgs of weight is distributed to the one lower limb and to the foot. Then what happens is, from here 30 kgs, half is actually transmitted to the posterior part or the heel of the foot, and the remaining half is actually transmitted to the anterior part of the foot, to the metatarsals, mainly to the 5 metatarsals. Okay, so 30 means another 15 and 15 will be transmitted. Now again of this, in the forefoot, what happens is, the great toe takes the majority of the weight bearing as compared to the, what you call as, the other lateral 4 metatarsals. Okay. Now it should be pliable enough for walking on uneven and sloping surfaces. So, for this and also to transformable the adjustable lever to resist inertia and powerful thrust. Now, excuse me, if you look at your lower limb from to the ankle region and then the foot, we will assume it is made up of a single lever. Okay. Now, if this single lever is present, but how to make it more efficient in actually for weight bearing and for propulsion? To this only it is made up of series of small bones and designed in the form of arches or spring. That means it is a single lever, but the lever is multi-segmented. Okay. So now you are able to see the foot, instead of being as a one big or a single piece of bone, definitely the single piece of bone would serve the purpose of weight bearing. The single piece of bone will again serve the purpose of locomotion or propulsion. You might think, then if it is single piece of bone, we will get better balance. We need not have so many ligaments and muscles maintaining all these bones. But what happens is we won't be able to adapt the foot for walking on various or different surfaces. So you are able to see here the ankle region from your lower limb and wrist is a single lever. Now this lever, if it is a single piece of bone, it can do the weight bearing, purpose of weight bearing, but it is a multi-segmented lever. The lever is actually broken down into multi-segments, but here in this picture you are seeing only the posterior and the anterior part of the foot. Now why, if it is not multi-segmented, then what happens? I will tell you. Segmented lever, mainly what happens is, if it is broken down into or divided into numerous segments, it can better adjust to the stress. Second thing is, as I told you, it can sustain a weight if it is a single long bone, and it can propel the body forward, but it cannot adapt to uneven surfaces. Our foot should be pliable and it is a resilient structure, and at the same time it should also be a rigid structure, which is very, very important. If it is a single lever, what happens is then the whole weight in propelling forward will be actually, we will be much dependent only on the gastrocnemius and soleus, our tendocalcaneus, which raises the heel. Because again there is a breakage of segment, especially the forefoot. You are able to see this forefoot. The forefoot stress or the propulsion is taken care of by the long tendons, the other tendons, which are flexor tendons and the extensor tendons, in raising your forefoot. So it is raising your forefoot, then again by the flexor tendons it will resist your forefoot. Okay. So depends extensively on the gastrocnemius. If it is not segmented, you will be solely depending on, and only the heel will be raised, then this has to take care of raising the complete foot, the whole length of the foot it has to act, and it will put great stress on these muscles. So because of this, if the foot is arched, instead it is arched and there are multiple joints where this single lever is divided into multiple segments, then what happens is it relieves the stress much, equal distribution of weight, and we can propel forward, and especially on the uneven surfaces. So to adapt and flexible to itself to uneven surfaces, it is made up of small bones, and these bones are held together, or they are actually supported by the mainly the arches and the spring components, which we will be discussing detail. So ultimately what we should understand, or the main purpose is, a segmented lever instead of being a single lever can best meet these stretches if it is in an arched form. So now we know why actually the foot is in an arched format. Okay. So numerous bones make up for these segments, and naturally they bring about the arches. The arches of foot develops in the later part of the fetal life. So what happens is, it develops only in the later part of the fetal life. When you see the arch of an infant and young children, what happens is, you won't be able to appreciate the arches because of presence of fat. Plantar surface, lot of fat and soft tissues. What happens? You don't see the arch externally, but definitely the arch is there in the skeletal element. The skeletal element arch is actually, what happens is present. In its skeletal basis, it is the arch which is not seen externally. As the child starts walking, then naturally what happens is, the arches of foot also becomes apparent externally. So definitely don't think, because you cannot visualize the arch in the infants, that is absence of arch. Arches is there, it is present from the birth, and our arches of the foot is dynamic, and it has got mainly two types of arches. From front to back you have the longitudinal arch, and also from side to side of the foot we have the transverse arches. Now, if you look at both the arch, the longitudinal arches itself on the medial side and lateral side, they are not actually equal in height. Then if you look at the arch at various stages during our standing, during our walking or jumping, the height might vary during various phases. One thing is, once when you jump or land, the arch will collapse, and once again it will become resilient and come to its original position. So this is mainly taken care of by the factors maintaining the arch, which we will be discussing elaborately in this lecture. Now, apart from that arch, the height of the arches also differs from person to person based on their weight, body surface, height, and all those things. And in some persons, of course, in some persons what happens is, the arch may be very low, that we will see, and sometimes it will be very high, but these are not normal. They will have some difficulty in walking and weight bearing. Okay, that comes under the applied aspects of today's class. So as I told you, you see longitudinally you have two arches. One is the medial arch and other one is the lateral arch. Both the arches, if you see, one arch is very much high and low. So they differ in height within a person itself. The medial and lateral arch are not equal in height. And same way the transverse arch is also, it is not a complete arch. You have a series of arches, and if you actually approximate both the foot together, then you will appreciate a complete transverse arch. Okay. So mainly now we have understood that it is a segmented structure which can hold the weight. So mainly the weight will be distributed, as I told you, to the heel. Half of the weight from the limb, each limb is distributed to the weight in the heel behind, and then the head of the metatarsal bones. Now, because of this arching pattern, not only walking, it also protects the underneath soft structures. Yes, otherwise what happens is these soft structures will be under constant pressure because they are compressed constantly, especially your vessels and nerves. Then you might have vascular symptoms because the vessels are compressed, or nervous symptoms when the nerves are involved. Okay, so the underneath the soft tissue structures are actually protected because of the arches. So that is also one more added advantage why actually we have an arched foot. So the main things, the skeletal element itself is a factor which is maintaining the arch, the bones. The shape of the bones plays a vital role in actually maintaining the construction of the arch rather than maintaining the arch. So the arches are mainly formed or built because of the shape of the bones. They are all wedge shaped. Okay, so like a wedge, and the pointing end of the wedge are actually facing towards the sole. Then very importantly, these bones has to be maintained in an arched format mainly by the ligaments. Which is helping to hold the bones together so that they don't collapse. And next thing is the muscles. The tone of the muscles is very, very important in maintaining the arches. Okay, and especially their role. The role of the muscles is mainly during propulsion or walking. And of course, the tendons, the long tendons. Muscles which I mean is the intrinsic muscles which are present within the foot, and tendons, you are able to see so many tendons which is again around the foot, like your tibialis anterior, posterior, peroneus, longus, flexor hallucis longus, flexor digitorum longus. These are all long tendons which also support the foot. They give a dynamic support. And more importantly, you will see the calcaneus, tendocalcaneus, which does not give a support, but mainly in raising the heel of the ground. And one more important factor is your plantar aponeurosis, which also plays a very, very vital role in actually maintaining your arches. Now we will see how each and every factor contributes for the maintenance, and before that let us understand how the arches are actually present in our foot. So you see longitudinal arches, they are two in number. One is actually the medial longitudinal arch, and other one is the lateral longitudinal arch. The medial longitudinal arch you will be able to appreciate in the medial border of the foot, and it is at a more higher level, and it can be appreciated well in your footprint itself. You can see your medial border of the foot will be very much curved or arched. The lateral part of the arch, or the lateral longitudinal arch, is not as high. It is lower in height, and it is mainly present in the lower border of the foot. Then we also have transverse arches. So the anterior part is actually complete, but more anteriorly, if you come to the head of the metatarsal, there is no arch at all, because the head of the metatarsals, they rest on the ground. So here you are able to see the transverse arches. and it is a series of arches starting from the metatarsals and most posteriorly coming to your tarsal bones, especially your three cuneiforms and the cuboid. So it is a series of arches from anterior to posterior, and you are able to see somewhat the arch is more pronounced anteriorly than posteriorly. But head of the metatarsals, there is no arch because they come and rest. Okay. So if you want to appreciate a complete arch, then you, for a transverse arch, if you approximate both the toes, both your foot together, then the lateral ends are actually touching the ground. Here this lateral end and this lateral end, and in between you will see a complete arch when you actually approximate both the feet together. Otherwise, in each foot you can see, in case of a transverse arch, it is more of a semi-arch, half-arched. And one more important aspect which you should observe is, look at the posterior end of the arch. Whether it is the medial longitudinal arch or the lateral longitudinal arch, posteriorly they converge at only one point, that is the calcaneum. Okay, so now you are able to see that is your lateral longitudinal arch. On the other side, what you see is the medial longitudinal arch. And transverse arches, you will have series of transverse arches from your metatarsals to the cuneiform. Okay. Now coming to the parts of an arch, any arch, whether you take a medial longitudinal arch or a lateral longitudinal arch, each arch will have a keystone and it will have two ends. The two ends is actually the anterior and the posterior pillars of the arch. Every arch has an anterior pillar and it has a posterior pillar. And here what you see is the keystone of the arch and also the highest point of the arch, which is actually called as the summit. The summit is the highest point. This point is actually the highest point of the arch. And these parts of the components of the arch are actually held together by the joints. They are held together by joints. Mainly they are called as the intersegmental ties. So between each segment of the arch, you will see intersegmental ties. They are also called as like staples. When you staple the paper, 2-3 papers together, they are like some staples. So mainly coming to the bony factors, the shape of the bones, as I told you, they are wedge shaped. Then the staples is by the ligaments, and then you have tie beam and slings, which is mainly by the muscle and the aponeurosis. So if you take any arch, each arch you have to discuss these factors, whether it is a medial longitudinal arch or a lateral longitudinal arch. You should discuss about, first of all, the shape of the bones, anterior and posterior pillar and summit of the arch for the longitudinal arches. Then which structures form the staples or intersegmental ties for each of the arch, which factors serve as the tie beam, and then which factor serve as a sling for the arch. So if you look at all the above factors, they are mainly responsible for maintaining the arches of the foot. So apart from the bones, you are able to see like a tie beam, some structures you are able to see here, and like sling mechanism, they are suspending the arch from above. They are giving support from the above. That is actually called as the sling mechanism. The two ends of the arch are actually tied like a bowstring. Tie beam, you can also call it as like a bowstring. We will better understand like a bowstring, because if you cut this then naturally what happens, the arch will not be maintained, it will collapse like a bowstring, sling mechanism. And then these short ligaments, they actually form the staples or the intersegmental tie for the arch. So as you look here, medial longitudinal arch, mainly what you are looking here, the shape of the bones are wedge shape. So this is the shape of the wedge. The narrow surface is actually, apex is actually pointing downwards, and actually the broader or the base is actually pointing upwards. In the same way you will be able to see the bones mostly here, wedge shaped bones mainly forming the arch. And what is a keystone? I told you summit is the highest point of the arch, and keystone is, if you remove that stone from the arch, then naturally this part of the arch and this part of the arch will collapse. So that is the main factor of the arch in construction, especially not in maintenance. For the construction of the arch itself, if the keystone is removed, then naturally there is no arched pattern. The arched pattern is lost. So now you know what is staples or intersegmental ties. So between the different segments which forms the arch, they are held together by this, which is actually called as staples or intersegmental ties. So bones, wedge shape of the bones contribute for the skeletal elements. For the intersegmental ties, you mainly have the short plantar ligaments and the long plantar ligaments, and also one more ligament, very main ligament, is the spring ligament. Okay, spring ligament and short and long plantar ligaments. So that is your spring ligament or calcaneonavicular ligament, apart from the short and long plantar ligaments. Then tie beam, as I told you, the tie beam or the bowstring, you are able to see it is actually tying the anterior and the posterior end. If this is your bow, this should be your bowstring. So if you cut the bowstring, then the arch will become as a straight line. So what are the factors maintaining the tie beam or bowstring? One main thing which you are able to see here is the plantar aponeurosis. You are able to see is mainly the plantar aponeurosis which maintains the tie beam. There are also other structures which maintain the tie beam. The muscles of the intrinsic muscles, not your interossei. Your interossei can actually serve as a intersegmental ties. The other short muscles, your flexor hallucis brevis, flexor digitorum brevis, abductor hallucis, flexor digiti minimi, all these muscles up with your plantar aponeurosis can serve as a tie beam for the arch. Now you know what is sling mechanism, or certain bridges. When you see, you call it as a suspension bridge, because instead of giving pillars underneath, the bridge is suspended from above. That is actually called as suspension. So here also the same suspension mechanism is also used. So multiple supports or factors come into action in actually maintaining the arch. So the sling mechanism, especially when your limb is fractured, to immobilize the limb, they actually tie like a sling around your neck and your upper limb is suspended. So the same component, sling mechanism, is actually put into action. So your sling mechanism is mainly maintained by your long tendons, tibialis anterior, tibialis posterior, and your peroneus longus muscle. Okay, so your peroneus longus, tibialis anterior and tibialis posterior, they are responsible for the sling support of the arch. Okay, so you are able to see that. And phalanges they do not form the arch. Even the head of the metatarsals, they are in contact with the ground. So, with respect to the medial longitudinal arch, we will see what are all the bones which are mainly responsible for maintaining the medial longitudinal arch. It is mainly at a higher level, and you can describe it as a large arc of a small circle. If you take a small circle and then you take a larger arching point, arc, if you take a larger arc of a circle, that is representing your medial longitudinal arch. Because it is a higher level, what happens? It is a more mobile. So, during weight bearing and during your jumping, what happens is it will compress and then it will become resilient, more resilient and more mobile. Your medial longitudinal arch. As I told you, it is more resilient. It can bounce back to its normal position. As compared to the lateral arch, it is mainly weight bearing. It is rigid. Your lateral part of the arch on the other side, you see, is more of rigid and weight bearing. You can see that the lateral part of the arch touches the ground first, then the medial part of the arch, because to absorb the force of thrust and weight. That's why I told you it is weight bearing. So that is why medial arch is less arched, lesser in height than the medial arch. The lateral arch is because for weight bearing and gives rigidity. This is resilience and that is rigidity. So bones forming posterior pillar is mainly formed by the calcaneum, especially the medial tubercle of the calcaneum. Then you have the talus, the navicular, and then you have the three cuneiforms and medial three metatarsal bones. So bones forming the arch are the talus, calcaneum, talus, navicular, three cuneiforms, and the medial or first three metatarsals. The ends are the anterior and posterior pillar of the arch is mainly formed. Anterior pillar is by the medial three metatarsals and posteriorly is the medial tubercle of calcaneum. So these forms the pillars of the arch. So I need not tell what is a pillar. All those things we have discussed elaborately in the previous slides. The highest point or the summit of the arch is the trochlear or superior articulating surface of the body of the talus. So that is the summit. Okay, the highest point of the arch is the trochlear surface of the body of talus. And even the talus forms the keystone of the arch. The talus is actually your keystone of the arch. Okay. Now, with respect to the pillars, you also should remember that the first metatarsal, it has also got two sesamoid bones. Two sesamoid bones, which we have already discussed that in our sole of the foot class. They are also included mainly in the pillars. They are developed within the flexor hallucis brevis and they mainly increase the force of contraction. So that is why these sesamoid bones are actually present near the head of the first metatarsal. The anterior part is somewhat longer and because of its lengthiness, it is weak and mainly formed by these bones from anterior to posterior, medial three cuneiforms, metatarsal and navicular and talus. Whereas posterior part, definitely it should be strong because made up of a single bone and by the medial half of the calcaneum. It is short because always we tell no, be short and sweet. In the same way, what happens is here the posterior part is not so long in length and because of itself it gains more of strength. Medial half of the calcaneum forms the posterior part of the arch. The main part is the talocalcaneonavicular joint, the vulnerable part of the arch is actually the talocalcaneonavicular joint. Okay, because this is the keystone of the arch, and this weight of the head of the talus is actually borne by this part of the calcaneum, the sustentaculum tali. So that is the main vulnerable part of the arch, and here below that it will be supported by the talocal, and it will be supported by the spring ligament. Okay. Bony factor is least important in the sense in maintaining the arch. Okay. Of course, if this bony part collapses, there is no arch, but in maintaining this arched form, it is only secondary. Okay, it is only secondary. Okay. So the intersegmental ties, what is holding the bones together? Main thing, as I told you, no, this the plantar calcaneonavicular ligament or the spring ligament. Okay, this is running below the sustentaculum tali. This is actually running below the sustentaculum tali because the whole weight of the talus is resting on this calcaneum, and below the sustentaculum tali it is supported by the spring ligament. So if the spring ligament is stretched too much, then naturally what happens is the medial longitudinal arch will get collapsed, and the spring ligament itself in turn is actually supported by this tibialis posterior tendon. Okay, the tibialis posterior tendon will send some slips to this mainly the spring ligament. Then you also have other ligaments connecting to the adjacent bones, short ligaments you have, and then mainly the plantar aponeurosis by its bowstring mechanism is responsible for maintaining the medial longitudinal arch. Intersegmental is mainly again by the flexor digitorum brevis, medial part of flexor digitorum brevis, and then you have the tendon of tibialis posterior forming the sling mechanism. Okay, so tie beam is mainly by the plantar aponeurosis. Plantar aponeurosis maintaining the medial part of it. Flexor digitorum brevis also acting as a tie beam. Flexor digitorum brevis, abductor hallucis assisted by flexor hallucis. These are all tie beam mechanisms or bowstring for the arch. Medial longitudinal arch, we have seen bones, shape of the bones, which is the keystone of the arch, which is the vulnerable part of the arch. Now we have seen the factors maintaining the tie beam is by the plantar aponeurosis assisted by these muscles. Flexor digitorum brevis, abductor hallucis. Okay, so flexor digitorum brevis and your flexor hallucis brevis and abductor hallucis all acts as a tie beam. Sling mechanism, so suspending from above and below, suspending the arch mainly by your tibialis posterior tendon. Okay, so your tibialis posterior tendon actually supports the arch from above like a sling, and then flexor hallucis longus, okay, this muscle, very massive one, supports the arch like a sling. In sling mechanism, medial arch most strongest in maintaining in the sling mechanism of the medial longitudinal arch, assisted by flexor digitorum longus and tibialis anterior muscle. Your tibialis from above it is suspending, this is going to the under surface and then it is suspending. So we have seen mainly the factors responsible for maintaining the medial longitudinal arch. Tie beam mainly plantar aponeurosis and the other muscles of the hallux. Sling is by tibialis posterior, anterior flexor hallucis longus. Intersegmental ties is main ligament is the spring ligament. Now coming to the lateral longitudinal arch, is low compared to the medial arch. Limited mobility, mainly it is a rigid and for weight bearing. The ends of the arches, lateral longitudinal arch is mainly formed by the head of the 4th and 5th metatarsal which is resting on the ground. 4th and 5th metatarsal which is resting on the ground. Posteriorly again medial tubercle of calcaneum. So both for the medial longitudinal arch and lateral longitudinal arch, it is the medial tubercle of the calcaneum which actually forms the posterior pillar. The summit is actually the subtalar joint between the calcaneum and your talus is the subtalar joint which actually forms the summit of the arch. The summit of the arch is mainly formed by the subtalar joint. Then one more thing which we have to actually understand is how between the cuboid and the calcaneum, it's the main joint, the calcaneo-cuboid joint. The anterior part of the calcaneum is actually kept in a raised position. It is because of the calcaneal angle of the cuboid. There is an articular process from the cuboid to the calcaneum, and this is mainly responsible for maintaining this. Most vulnerable part of the arch is the calcaneo-cuboid joint. So 4th and 5th metatarsal and the medial tubercle of the calcaneum. Again anteriorly it is long and weak. Posteriorly it is actually stronger by the medial half, not by the lateral half. Sorry for the mistake there. It is actually the medial half of the calcaneum, and main joint, as I told you, is the calcaneo-cuboid joint, most vulnerable part of the arch. So you are able to see again bones are mostly wedge shaped. Okay, it is actually wedge shaped which you are able to see here. Then it is mainly maintained by the short and long plantar ligaments. So you are able to see the lateral arch by the short and long plantar ligaments which is responsible for maintaining the arch, and some dorsal ligaments between the calcaneum cuboid and the related metatarsals. So they all form the intersegmental ties for the lateral longitudinal arch. Then bowstring. Bowstring, to some extent it is by the plantar aponeurosis. Then you also have flexor digitorum brevis, lateral half of flexor digitorum brevis. So lateral part of plantar aponeurosis which is cut here, and flexor digitorum brevis lateral part, and abductor digiti minimi assists along with the flexor digiti minimi. So they form the tie beam or bowstring for the lateral longitudinal arch. The sling mechanism is mainly by the peroneus longus muscle. So goes to the under surface by peroneus longus. From above it is also assisted to some extent by the peroneus tertius muscle and brevis also. Peroneus tertius and peroneus brevis. So we have finished about the longitudinal arches. Next coming to the transverse arches. So you are able to see transversely also our bones are oriented in an arched manner, and you see series of arches which I have been telling in the beginning of this lecture itself, and it is by the metatarsus and the adjoining tarsus. So excluding the head of the metatarsal, starting from the shaft and base and up to the cuneiforms and the cuboid bones, you have series of transverse arches. Okay. So metatarsal head, they rest on the ground, whereas the posterior arch which is formed by this is actually incomplete. That is your tarsal bones. So that is why you have an half dome. It's not a complete. You put both foot together, then you get a complete arch. Each arch has got only half doomed or part of the transverse arch. Okay. So you can see the head of the metatarsus resting, and the transverse arches is actually formed from there onwards behind, and this part will be almost incomplete. So here you are able to see the transverse arches in a section. Most anteriorly it is your phalanges. They don't form an arch. From the metatarsals and then the tarsals you are able to see. And kindly note down the adductor hallucis muscle. They are also going to form the support for the arch, adductor hallucis. Then how actually your tibialis posterior, peroneus longus, they are responsible for maintenance of the transverse arch, especially the peroneus longus. So next, the other factors of the transverse arch, how it is maintained. Bony factor, perfectly wedge shaped. All the bones you are able to see, they are perfectly wedge shaped. So here that is why the bony factor is important. And especially for the keystone which occupies the center of the arch, this bony factor is very, very important. Otherwise the transverse arch collapses. The inferior edges are actually tied together by the ligaments. You all know that deep transverse metatarsal ligaments. You know, between the metatarsals, what originates is your interosseous muscles, mainly your dorsal interosseous. They also can act as intersegmental ties. Okay, intersegmental ties is by the deep transverse ligament, and as I told you, strong plantar and interosseous muscles. And in the last slide I showed you about the adductor hallucis, the transverse head of adductor hallucis. They also are responsible for the intersegmental ties, adductor hallucis. How actually they are holding the bones together. So tie beam or bowstring. Tie beam or bowstring of the transverse arch will be mainly maintained by your peroneus longus tendon, since it is passing from the lateral to the medial side. So it helps to maintain the transverse arch. Sling mechanism is again by the peroneus longus because it is going above and brevis, and to some extent it will be assisted by the tibialis posterior tendon. So shape of the bones we have seen for all the arches, then we have seen about the ligaments, then we have seen about how the intrinsic and also the long tendons. Now of these, which is most important? We cannot pinpoint and tell that this factor is very, very important. It is actually a combination of all the factors. But when and how these come into play? When you are standing and when the weight bearing is actually taking place, what happens is the plantar aponeurosis. It is the plantar aponeurosis and the plantar ligaments which actually support your arch. The muscles mainly come into action when you are walking. So during your walking, what happens is the muscles become very active, and what happens is there is the great toe is dorsiflexed, passively dorsiflexed, and the plantar aponeurosis by its windlass action will approximate the heads of these metatarsal towards the heel and thereby increases the height of the arch. Are you able to understand? It is actually will increase the height of the arch. So muscles mainly active during walking and running. So that is why you cannot emphasize one single factor. It is the muscles which maintains, or it is the ligaments. Both act in different phases and gives support to the arch. So ligaments, as I told you, play a major role during your static posture. So muscles mainly during movement, and especially peroneus longus in the transverse curvature, maintaining the transverse arch. So you can see in your foot the weight bearing areas. There are actually 6 points. One in the heel, very large weight bearing area, and then you are able to see in the front for the head of the metatarsals, and again ball of the great toe takes almost half of its weight. So these 6 points are actually the contact points which helps to distribute your body weight. Okay, so these are all the weight bearing points. As I told you, when there is a passive dorsiflexion of the great toe, when there is a passive dorsiflexion of the great toe, what happens is the weight bearing foot successively is transformed. First the heel is raised, okay, then the ball of the foot, and the last part to leave the ground is your anterior pillar of the medial longitudinal arch. So when there is dorsiflexion, it increases the height of the arch. So extension of the toe will elongate your flexor hallucis and flexor digitorum muscle. So this increases the force of subsequent contraction and increases the force of takeoff. At that case, what happens? The lumbricals, when this is going to take off, it will prevent the buckling of the toes. So thereby now you know how actually increases the takeoff is by tendocalcaneus. Heel is raised. Flexor hallucis and flexor digitorum longus, they all increases the force of contraction by when the mild dorsiflexion of the great toe is taking place. The lumbricals prevent the buckling of the toes. So mainly the spring action helps in walking and running, acts as shock absorbers, mainly when you step down. So when you jump from one surface to others, you can see the arch is compressed, then it has to become resilient and to walk on uneven surfaces. So these are the main function you can tell of the arches of the foot. So finally we are actually coming to the applied anatomy of the foot. First we will see about pes planus or flat foot. So here you are able to see an arched foot, here you are able to see a flat foot, which is more evident in the footprint also. So here in the flat foot, what happens is disappearance of the arches. It might be due to increase in weight or weight bearing. Then it might be due to loss of tone of the muscles and fatigue of muscles due to prolonged standing, or due to some ill-fitting footwear or bad walking mechanism. All these things, what happens is, will be responsible for the flat foot if it is acquired. Sometimes the foot arches might be absent even congenitally. The next is the opposite of the flat foot. But before that, if you have a flat foot, your gait will be shuffling because of loss of the spring action. You have a shuffling gait, trauma to the underlying vessels, and you are most prone for osteoarthrosis because all the bones and the soft tissues are under constant pressure. So vessels and nerves might get compressed because of the flat foot. So you might get pain, neuralgic pain, and blood vessels you will have ischemic effect. Pes cavus are highly arched foot. The opposite of pes planus, flat foot, is pes cavus, exaggeration, okay, of the longitudinal arch, and there is always a plantar flexion at the transverse tarsal joints. There is plantar flexion at the transverse tarsal joints. So contraction, plantar flexion. The common causes actually for pes cavus is it will be associated with spina bifida, a condition which is actually called as the spina bifida, poliomyelitis. Now here one more thing you are able to see here, this is actually called as the Hallux Valgus. So the grade 2 is actually adducted. It will be adducted towards the midline of the foot and some degree of abduction of the metatarsals. Some degree of abduction of the metatarsals. So deviation of the grade 2 also takes place by wearing very narrow or pointed shoes. So always the first toe will be abducted and the metatarsal will be abducted. This is actually called as Hallux Valgus. Okay, and you can see a bunion actually developing here in this projected area. Okay, that is about the Hallux Valgus. Other deformities include mainly the Talipas equinus. So your foot is like a horse, which means he walks only with the heel raised and with his forefoot. That is actually called as Talipas equinus. Foot is flexed in the plantar position and the toes are always directed to the ground. So he always walks practically with the fore part of the foot. Then you have Talipas calcaneus, in which the heel is on the ground and the toes are raised. So in a dorsiflexed position of the ankle joint is actually called as Talipas calcaneus. Heel is to the ground and he walks with the foot raised. Then you also have other types which you can call it as Talipas varus. Foot is fixed in inverted and adducted position. Then valgus, foot is fixed in everted and abducted position. Okay, Talipas valgus, Talipas varus. Now a combination of this primary deformities can lead to a very common condition of the foot called as the Talipas equino varus or the club foot. Talipas equino varus, most common type. Patients walk on the lateral border of the front of the foot. Patients walk on the lateral border of the front of the foot. The foot is actually adducted and plantar flexed. The foot is mainly adducted and plantar flexed. So you are able to see it is inverted, adducted and actually plantar flexed. It is a combination of the deformities. Mainly what happens is it is congenital club foot due to failure of the muscle growth to keep in pace with the skeletal growth or growth of the bones. So there is some imbalance between the growth of the bones and the muscles, mainly the Talipas equino varus or club foot. Okay, the foot is actually adducted and inverted and plantar flexed. So that is about the Talipas equino varus. So thank you very much for your patient listening.